Appreciative that you are taking time out of your busy lives and schedules to join me, Lily Talcott, the Deputy Superintendent, and with me is
Carrie Burke. I am the Coordinator of Health Services and Wellness for the district.
And this evening we're going to go through some frequently asked questions in relationship to COVID-19 and the Ithaca City School District's response and preparation for COVID-19 in general. All right, so with that, we are going to transition and go through a series of slides, share some information, and as time permits, we will be able to engage in some live chat questions as well and answer those. Again, we are so grateful for your support and your attention to this matter and to, of course, all of our children and our staff in our community. So thanks a lot.
So to begin, what is COVID-19 or coronavirus? If you've been following the news, I'm sure you've been hearing a lot about it. It is part of a family of viruses. This particular strain, being referred to as the 2019 novel coronavirus or COVID-19, is a new strain that was originated in China. Preliminary data suggests that the vast majority of persons being affected are adults and older persons. For those with underlying health conditions or compromised immune systems, there could be greater risk of severe illness. I would encourage you to reference reliable sources for information regarding coronavirus, including the New York State Department of Health, the World Health Organization, the Centers for Disease Control and Prevention.
Great, so what is the role of schools in responding to COVID-19? It's important for us to plan and prepare. Our job is to ensure that we are preparing and that our preparation is as informed and logical and proportionate to the risk as possible, right? And we work very, very closely with with local health departments, and we all have a role in slowing the spread of the disease, right? So schools are not expected to screen students or staff in order to identify cases of COVID-19. And the majority of respiratory illnesses are actually not COVID-19, so that's also important to note. We're going to pause for just a moment and ensure that our technical situation is up and running and that we are all set. Great. All right. Fabulous. Looks as though everything is working just fine. Thanks so much.
So, what is the role of parents and caregivers in responding to COVID-19? First and foremost, I think the most important thing we can do as community members is to ensure that we are staying home when we are sick. As Lily mentioned, COVID-19, the signs and symptoms are familiar to many other common respiratory illnesses. If you suspect that your child is not feeling well, it is essential they do not attend school or go other public places such as childcare centers, the mall, or sporting events. Among the most important things we can do is to teach our children everyday preventative measures to help prevent the spread of respiratory disease. They include things like washing your hands frequently with soap and water for 20 seconds, using hand sanitizer appropriately, and covering our coughs with tissues or by coughing into the inside of our elbow. As adults, we can play a role by ensuring that we ourselves are providing a good example to our children, and engaging in these same behaviors.
So how do I talk to my children about COVID-19? The first important step is just to listen to children, right? And to validate how they're feeling and then correct potential misinformation. The preventative measures that Carrie just talked about in relationship to washing hands and using hand sanitizer appropriately, of course staying home when sick, covering coughs and sneezes, etc., is also vital as well. Correcting misinformation, of course, can be done best through visiting websites such as the Centers for Disease Control, the New York State Department of Health, and/or the Tompkins County Health Department website as well. Families and staff may also find particular child-friendly informational resources supportive, such as a publication or comic that was put out by National Public Radio not that long ago, which is referenced in our frequently asked questions document, which we are updating regularly.
So what is the role of the Ithaca City School District in preparing for COVID-19? We are engaged in a host of activities, first and foremost, remaining in close contact with federal, state, and local authorities. We are reviewing and revising our emergency operation plans. We are staying in close contact with those officials on a daily basis. We are monitoring student and staff absences. We continue to implement our current cleaning protocols, reminding staff of these protocols, including the enhanced protocols provided recently by the New York State Department of Health. We are encouraging good personal hygiene, including hand washing and use of hand sanitizer. And we are working to communicate often through the various channels available to us, including tonight's presentation. I should add, we are also committed to fighting bias in the midst of this outbreak. We recognize that misinformation has the ability to travel as rapidly as a virus, and so we are being very thoughtful and intentional about our engagement with our staff and students and leaders to ensure that we are not stigmatizing or introducing bias as we express concern and engage in these activities around monitoring and otherwise.
So a question that we are occasionally getting is whether or not schools can release the names of students who are exhibiting symptoms to local departments of health. And the answer is yes. In an emergency, the Family Educational Rights and Privacy Act, or FERPA, authorizes that disclosure without consent. Obviously, we collaborate with the Tompkins County Health Department so the families know, and we communicate to any appropriate parties in connection to the emergency.
So what about the students and families who are quarantined by the Tompkins County Health Department? So throughout our community within ICSD, Tompkins County may ask folks to quarantine themselves. We regularly communicate with them regarding these situations. At the same time, we are upholding the student and family's right to confidentiality. Students and families who are quarantined may be asked to restrict their movements and travel based on their potential exposures, and the county is responsible for implementing these procedures. It's important to note that there's a difference between the words quarantine and isolation. Quarantine is used to separate and restrict the movement of well persons who may have been exposed to a communicable disease to see if they will become ill, whereas isolation is used to separate ill persons who have a communicable disease from those who are healthy. In the case of students who are quarantined, they will continue to receive work and support remotely, and their absences will be considered excused. We feel this is a vital aspect of our role as a school district in serving our students and their families.
We've also received the question, who is permitted to actually close schools? So the decision rests with our local Board of Education, superintendent, in consultation with our local health authorities. So we would not be making this decision in isolation of health authorities, right? Schools are, of course, required to follow the requests of local health departments and county emergency managers, as well as any emergency managers from the governor's office, right? And the New York State the New York State Commissioner of Education also has that authority to close schools under extraordinary circumstances. And obviously we are going to work in close partnership with those local and state authorities in order to make a determination if absolutely necessary. So if warranted, how would a school or our school handle an extended closure? So of course we would continue to collaborate with local and state authorities and in order to make that determination, of course, in the first place. And then we would utilize any guidance from the New York State Education Department. But in the event that we did have to engage, engage in an extended closure, we would begin our plan in order to support the continuity of teaching and learning, our remote learning education plans, right? And so we've been developing these to ensure that they're as comprehensive as possible. We've been working with national and international organizations like ICSD and COSIN. And our current attendance policy in the meantime remains in effect. And that's also linked right on our FAQ document. So if you have any questions about whether an excuse in the meantime is determined excused or unexcused, please just reference that. That will give you your clearest information.
So how would public schools non-public schools, be affected by decisions to close? They are governed similarly like the public schools and would be subject to any declaration by the governor and any request to close by health departments and local emergency managers. Are additional cleaning protocols being instituted in schools? The answer is yes. Governor Cuomo recently indicated that we will be providing, or they did, provide new cleaning protocols, and we have implemented those. This includes routine cleaning and paying special attention to high-risk locations, including the lunchroom, health office, and high-contact surfaces. If an individual is to be confirmed as having COVID-19 through laboratory testing, we additionally have protocols to respond that would involve cleaning and disinfection throughout the school environment.
So how are schools handling concerns regarding international student and staff travel? Well, the Tompkins County Health Department is responsible for outreach and assessment in terms of those folks who are returning from countries with confirmed cases of COVID-19. And as we continue to say, we are maintaining close communication with the folks at the County Health Department. They have been excellent to work with, and they are, any instance that arrives, they are fabulous at communicating with us as quickly as possible. We're also going to be working with them and the U.S. Centers for Disease Control and Prevention in terms of making decisions regarding any upcoming trips, so school-sponsored trips that may be on the horizon. So at this time, we just wanted to give folks an opportunity to take a look at our resources. Please feel free to visit those as often as possible, as there are updates there daily as well. We are also providing updates through our website and through our own FAQs as well. And we are happy to, of course, answer any questions that folks may have that may arise. We are happy to receive these questions, comments, and concerns both through our Let's Talk portal and the ICSD communications page that's listed on the school district website and that we put out via our communications today as well. Obviously, Carrie and I are available as well at any point. Although we have been following the live chat and keeping up to date to see if there are any questions, we don't see any that we currently need to answer. So we are, of course, always available and happy to discuss things with folks as much as possible. And we will be continuing to update folks periodically as new information arises through our website and through our ICSD communications work. So, with that being said, we are going to say a fond farewell to everyone this evening, and we really, truly appreciate all of the time and effort that you're putting in order to make sure that our kids, our families, our staff, our community are as safe as possible. Thank you for all of the preventative measures that you're taking. I'm going to say a huge thank you to Carrie Burke and our nurses and our other staff, teachers, ESPs, custodians, principals, bus drivers, aides, everyone who has just been phenomenal in terms of their response to this. So thank you, Ithaca community. We will be in touch soon, and have a lovely evening. Good night.